recall。OK，好，行，那你现在下面的是王老师的是吧？我把那个王老师的，哎呦，课件还没打开啊，稍等一下，我看啊，头针治疗什么是疾病？这样，
这个题目是站桩就跟我一起站，三个消化的，要站就都可以的。我一直是王老师的啊，
这上面写的呀。
啊，那小就你再听着。
啊，我告诉他可能有一个
啊，对对对，我那个
临床英文
不是关系
啊，
，step 是基础知识。好，写的挺好。一个教导导都一个教导挺好。这那个你刚教导的问题，你都是这样。赶紧你好好给他说一个这样的，没上学都是赶紧回来。
Good afternoon, please come back now. So next speech will be Dr. Wang Tianjun. I'm a great fan of sculpture acupuncture, and I'm learning sculpture with Dr. Wang for over 10 years. I use my sculpture acupuncture to 运感区 every day to top up my energy, like middle jaw energy swing up, kind of a 补中益气汤. I mean, yeah. So please, Dr. Wang, welcome.
从哪口吧？啊
Welcome back. Maybe you notice there is it's an interesting color with a Q or something interesting. Can you imagine? Yeah, that is something interesting. I don't really explain a little why there's so many interesting on the Q there. All right. Thank you very much for Dr. Yu Rong Liu to introduce my speech in the afternoon. As you know, this afternoon is our special conference working with CAHMA together. We call the Academy of Scape Acupuncture, ASA, annual conference. And this is the fifth year of established of the ASA. Because it's the fifth year, we working together with our special supply, local product, the 顺天堂, the special design of a special scatter acupuncture needle for give us our conference a very special offer, which means that 50% of that special scatter acupuncture needle. So that's the reason why that over there it's so interesting. All right. So now, because of time limited, yeah, I do not spend too much time on other issues. So today, as you know, it's our conference. So I choose this subject as our this afternoon the special ASA conference most focused on the mental problems. Most mental problems. Of course, for mental problems, we can use our general acupuncture, pillar massage, home medicine, etc. But on scape acupuncture, there are some special areas or points that are more specifically for mental disorders. So I choose 5 of them, put them together, make a simple list for everybody. In the future, if you have any mental problem patients, you may find, oh, Dr. Wang mentioned that there are 5 points or needling we may choose for mental problems. So that's the reason I choose this approach. My talk will be based on the previous years, the clinical experiences. As you know, I have practiced acupuncture after my graduation from the Nanjing University of Chinese Medicine in 1989 So by this year, exact 35 years of clinical practice after 5 years education in the Nanjing University Chinese medicine. Some of my colleagues and students, they visited my university last month. They visited the old campus where I stayed 5 years in Nanjing, the University of Chinese Medicine, the Hanzhongmen campus. Some of you is there. So based on my basic education, my clinical experiences, and of course my research, particularly my PhD research, acupuncture for depression. So some of the ideas I highlight on my publish this kind of difference first, such as for the depression, for stroke, for the brain knowledge, etc., etc. And finally, as you know, as this morning I mentioned, the ground summary of my knowledge, my theory, my technique, and the clinical practice was published in by this authored book I mentioned. In this book, you can see half of the are treating for mental disorders. This treatment, including basic TCM knowledge, basic Western medicine knowledge, basic acupuncture treatment, and the unique brain acupuncture treatment, and with some research background as well. So these are in this book. So that book is a key conference, a key references for anyone if you are interested for further reading. Even you may introduce for some patients. You know, some patients will they have quite high educated. They are interested to know why. What's the background you can treat depression or addiction or epilepsy? Why? You want to know why. So you can recommend, in this book, explain why acupuncture can help. Second called one. She bought my book and she really called so she was way to end it. Big on a trip. You can see this book she has already investing from the animals. I used to write here, so this book. Thank you guys.
So it's really great smart class. They can I come and book from us. I'm going to call this good.
She put my public book. It's a character for 8 posts, including our lecture this morning, Dr. Shua and Dr. Olivia Bo. We include 18 colleagues to write this book. So the main problem yeah, you may very interesting to think about this. Thank you. And about this book, about the in Chinese as well. So you can say each chapter with diseases, including general advanced medicine, TCM studies, general for the treatment, unique brain for the treatment, research and references, etc. Yeah. And thank you, Dr. Liu Dongye. He contributed one chapter in my book as well for the anxiety. So thank you, Dr. Ye. And also requested by some colleagues, because that book is quite detailed, comprehensive, but a little bit complex and too heavy. So working with the association of the ASA, we published a short or the handbook of scalp acupuncture, which much easier to hold in your bag. Everybody? Thank you. Yeah, what my student, just this handbook, you can put your book on the page, much easier for you to choose the area in your practice. So that's something you may think of in the future. Yeah. All right. So now we move on for the today this afternoon the topic about the mental disorder treating with scalp acupuncture. And as I mentioned, for the TCM brain knowledge, the brain-related diseases, there are in total 3 categories. First one, it's most commonly used is the neurological diseases. As you may know, 53 years ago, Professor Zhao Shunfa created this special Toujhen or scalp acupuncture, most focused on the neurological disease. As you know, he was a neurosurgeon. 他是个西医的神经科大夫，神经外科大夫。So he created this special technique was most focused on the neurological diseases, stroke, Parkinson, dementia, brain tumor, brain cancer, brain injury, etc., etc. Now, in the last 15 years, he and myself, we realized for brain acupuncture treatment, only for neurological diseases, but also benefit for mental disorder as well. So now we in his book and my book, also we cover the scavenger for second category is the mental disorders, such as there's depression, anxiety, bipolar disorder, insomnia, epilepsy, schizophrenia, addiction, etc. So all these things we call the mental disorders. But of course, other diseases also we mentioned this morning, such as some of these, including some of the skin problem, also can be used to treating with scalp acupuncture. Yeah. So now move on for the we call the mental disorder. How to understand mental disorder? So I'd like to give you some very briefly background about mental disorder. First of all, mental disorder is just a health condition changes in anything thinking, anything or and behavior problem. Any of this changing, we call this the mental disorders. And also mental disorders related for the distress, function, social, working, family activity, they are all mental disorders. In addition, mental disorders, nothing to be ashamed of. As you know, based on particularly our Chinese culture, some of us, particularly our old generation, they are shy to talk about the mental disorder. 中国人不愿意承认精神系统有问题，认为这个是神经病，不敢说有病也不敢说。So this one reason, some of the hospital has changed their name from mental disorder hospital or psychiatrical hospital to brain. As a big sum in China, in Nanjing, the one of the topic is for the hospital. It was called the neurological and psychological hospital, which is the top, at least top 5 hospital in mental disorders in China. But because of the shy of problem culture, now this hospital has been changed the name called Nanjing Brain Hospital, which is the hospital I did my PhD research in the hospital. So, well, actually, mental disorder is a health problem. It is similar to high blood pressure, diabetes, etc., etc. But from our culture, we are not easy to do that. So, mental health can and improvement is possible. Definitely, we can use our knowledge and skill to help mental disorder. And mental disorder is very common. Very, very common. There are some figures mentioned, such as about 20% of adults has some kind of mental problems. Yeah. And about 5% have the severe problem. And some of them have the problem in daily life. In simply review, as you know, traditional TCM, Chinese medicine, has a long history to thinking about, and help about mental disorders. From TCM, mostly we related for the 7 emotions. 怒喜, 慈悲恐, 5 elements with the liver, with the 肝心脾肺肾, with the liver, heart, spleen, lung, kidney together with the 5 emotions. We use the 5 organs to help them. We help the many problems very quickly. And each of the Shen disorders related for each of the 5 organs. And we have the Shen, Yuan Shen. Also, there's a special point for the 13 ghost point. I don't know if you heard about this. In the TCM history, some of the TCM doctors, they choose some of the commonly used acupuncture point to treating mental disorders. Different doctors, they may have slightly different experiences in different books. The most famous book, the 13 ghost point, published by Sun Simiao, 大医精诚, on his golden formulas for the diseases. He published his ghost point for the 13 ghost points to treat mental disorders. Some colleagues still use this point to help mental disorders. Some of them are
still commonly used. I will mention it on next slides. Nowadays, with the new development of this brain acupuncture, nowadays more research and practice on the brain and the mental disorders in the last 50 years, such as ghost point. Yeah, very briefly, I don't spend too much time. Just give you a very brief idea. Oh, ghost point, you can see 13 of them, but none of each point from heart channel. No any heart channel. 6 of 13 from 动脉，人中风府神庭。2 of them from 神脉，沉江 and 会阴。And only one 海泉 is underneath the tongue, which is also on the 动脉 channel or on the 任脉 channel. So in totally 6 of them comes from 动脉 and 任脉. No any point from heart. No any points from liver. As you know, traditionally we use the liver G stagnation, liver 3, liver 2, liver 14. For heart 7, etc. We use them. Interesting. From 分子秒 ghost point, they never use this point to treating mental disorders. They are very, very interesting stories or cases in the future if we have time to talk detail about these mental disorders, ghost point. Okay, now move on for the commonly used acupuncture to treating mental disorders. Of course, first we can use our general acupuncture to help mental disorders, general acupuncture, and also including from the Dr. She mentioned this morning about the Wu's acupuncture needles, and Dr. Ye about the Xunzhen, etc. They all can good for mental disorders. Yeah. But from the brain acupuncture, majority we use the scalp acupuncture and 导气 technique on 动脉 and 任脉. We put them together, scalp acupuncture, 导气 technique. I put them together in the brain acupuncture, which is published in my book. So here we mentioned the brain acupuncture. Majority use the scalp acupuncture and the 导气. But for today, we mostly focus on the scalp acupuncture. Detail about the 5 brain needling. Here, 5 brain needling is not only 5 points, but 5 areas with blue points we mostly use to treating mental disorder. First one is the 动脉 16 风府. You know, 风府 we mentioned it from 黄帝内经 said the brain is the seat of marrow. It's transport the qi to the top of scalp and down to the 216 风府. So from 黄帝内经has already mentioned the brain related to the 动脉 and particularly on 风府. So we use the 风府 with the 导气 technique. That is a special technique. And then some of the other brain acupunctures, the scalp acupunctures. On the top, we use the 中央区 central area plus foot motor sensory area. That on top. Then on the back head, we use the medial control area plus the balance area. Then we use the emotion area, spread emotion area, which is exact on the top of the frontal lobe. As you know, frontal lobe is the key area to regulate and control our behavior, memory, cognition, concentration, etc., etc. And finally, in the front of the head, we use the head area, HAD head area, and the thoracic cavity area, or the chest area, which is side of the head area. So these 5 area of points, some are just on point, 动脉, some are only one. It's pretty important. Some areas are acute points. These areas are commonly used to treating mental disorders. You can use either just one of them, independent individual patients, or you can use some of them working together for treating mental disorders based on the patient's their individual symptoms and how response of your treatment. Such as at the beginning, I must use 1 or 2 of them. If occasionally some of them are not good response, then I may add another or change it to another group. Such as in severe mental patients in my clinic,
I must suggest them at the beginning, come to see me twice a week. And I use two groups. One group is face up. We use image area, head area. And one group is face down. Then I may use the back one. So give you an option to treating mental disorders. Yeah. Yeah, this is the picture about these areas. Such as we said, the mental central area, good motor area, balance area, manual control area, spirit emotion area. These are the three brown, the head area and the thoracic cavity area. Okay, the 胸腔区, 头区, 胸腔区. That are the commonly used areas for also this one. As you know, this is the 2x16 丰富 is a perpendicular insert. Yeah, hopefully in the future we may do more detail of the needling. But today is mostly give some idea, some opinion, not detail of each technique. We have time limited. And also give you a little bit of picture about the commonly used. This area is the mostly new area, published only 15 years on the second edition of Scapula by Tou Zhen, by Professor Sun Fa Jiao, which is commonly used for emotional problems. Unfortunately, in the Western, so far, no any book published in English to explain this area for mental problems, except my book, Acupuncture for Brain. So if you're interested for mental disorder treatment, that book is the moment only one choice to treating mental disorders. Yeah, and it's about for almost all mental problems, including brain fog during the pandemic, as you know. And in addition, we mentioned the special needle. As you know, our normal needle for single use, it's okay. Any needle, any size needle are all okay. But for scalp as you know, we need to insert in a certain angle of the needle. And because our scalp skin is much thicker than other skin, so we need our needle more power, more strong, and more flexible. Many areas, they are 4 centimeters, such as spirit emotional area, such as the balance area, manual control area. They are 4 centimeters. If we use our normal 1/2 turn 4 centimeter needle, then we have about 5 millimeter not cover. For example, we try to cover all the line. So working with homeopathy, we designed this special needle. There's a polymer by the Scapula Institution. It's our total union ASA, the support. So this we can say the handle is much thicker and longer. The body is much high quality and slightly longer, 44. And the quality of the body is much higher than general needle. So this is a special needle. As I mentioned today, is a special offer by the company as well. Give us the company. And about Dao Qi, yeah, just to give you one idea. 14 years ago, I published my first English DI paper on the acupuncture in medicine, which is a part of BMJ, British Medical Journal. In this book, apparently my acupuncture for depression is a randomized controlled trial. In this paper, the first time published Dao Qi in this book. It was a very long history how to publish this book, accepted by these medical doctors. But finally, this is the first book, a first paper published in the Western country mentioned about Qi, Dao Qi technique. And about the Feng Fu Dao Qi, this picture, I also learned this figure. They just published 2010. This even in Western medicine, this is the new development area. This indicates underneath the 2x16 Dao Qi, 2x16 the point, there is a special structure of anatomy called medullary bridge. In Chinese, we say the 基膜桥 medullary bridge. This is between the skin, the muscle, and the C1 and the C2, or the C1 to the occipital bone. There's a special, very tiny bit of structure which connected the muscle to the spinal. we can't directly stimulate the spine, but we can touch this little muscle to make the spinal fluid, the fluid smoothly. Something like we said, clear the channel. Then that make the brain directly regulated by the spinal fluid smoothly. This is the reason why we need, when we're treating brain conditions, we need to do my 16 more deeper. You only insert half turn or 1 turn. You will not touch the special bidural bridge, then your regulation for the brain will be much less. So that's the mechanism. From Chinese medicine, Huangdi Leijing, from Western medicine, this bidural bridge. Then, because time, I give you some case study. This case is a special depression patient, which he was 25 years old, suffering depression more than 5 years. He has tried many treatments, unfortunately not great. So he has no choice but quit from the university. He can't continue university. During my home visit for his grandson, for his grandpa, 他的爷爷 for dementia, then his mom invited me to treat this boy with acupuncture. But he was very sensitive to needles. You know, some patients, they don't like needles. They are very sensitive to needles. After many times consultation, he said, you can only try one needle. If it is pain, his pain is so dirty, he don't like it. I only try with one needle now. So during my workshop, I asked, if you have this patient, how do you choose points? Someone said, oh, you choose the 20 by 20, your emotional area, use you can use level 3, you can use 1924. Okay, thank you. These points are good for mental problem, but not good for him. He's too sensitive. So I choose a point very good for mental problem, but very less sensitive, which is yes,人have 中脘. 中脘 is a good point for mental problem, but very less sensitive. I use the point, he has no anything. Then I put other. You can say here's emotional area, here's the head area, but these are the stomach. And you can say stomach 25, spleen 10, etc. I use this stomach point. Main reason is to treat his chocolate addiction. Because in the last 2 years, he can only have temporary, a little bit relaxed and happy when he have a package of chocolate. So he has an addiction of chocolate for 2 years. He has gained 20 kilos for the last 2 years. So I use this treatment. It's better. And after the 5 sessions, one day he asked me, Dr. Wang, may I fly to Belgium? Why? His mom refused. In the last 5 years, he never fly to abroad. Then his mom asked me, do you think Dr. Wang, he can fly? So after my assessment, I said, yes, he's good enough. Then he fly to Belgium with some other friend, best man for a wedding for a friend. Then he come back, he said, Dr. Wang, thank you very much. I'm very happy and enjoying the wedding. You know, for depression patients, they have no enjoy. That is one of the key problems. So not enjoy. That means it is much better. And I have many videos on my YouTube. If anyone interested, you can visit. This is a very special lady. He was a very severe, but had a much better after the first treatment of a back tube, something like a light mat. Yeah, she agreed to accept the video published on my YouTube. Yeah, interesting. And this patient, this patient is a bipolar disorder. I put this patient here. The majority reason is, can you notice what is? Yes, it's a lympho point on scar. He did lots of moxa, strong moxa, very strong, to burn in the skin. He heard from some master doctor. He said, you are very Yangqi business. You need strong mobs. Then he gets some mobs maybe temporarily comfortable because of war. Then he mobs himself with 3 mobs together because he's very lessened to the law. So he won't hit himself. So he this one. No matter as well. But still not helpful. You know, bipolar disorder even more challenging than depression or anxiety. Many movie stars or artists. So this disease is also called the creative disease. Most patients, they have very creative thought. They have this bipolar disorder. They have 2 faces. In front of the stage, they are very exciting, etc. But after the stage, they are very depressed. So that's bipolar disorder. And you can say severe hallucination. This lady was a high-level manager in an international bank. She's suffering from the severe hallucination. You know, hallucination is 幻视幻听，非常 very severe. So he came to see me, I think from Birmingham somewhere, 2 to 3 hours travel by train. Came to see me after several years. Then after treatment, she published Google review on my website. He said, I would look without medication, even if you have had acupuncture previews, because she has tried acupuncture in local clinic. Unfortunately, not great. Yeah. I have been suffering from mild to severe hallucination in the first hour of sleep for many years. It can be very frightening. I found that the severity of them is immediately after seeing Professor Wang, and the progress has been excellent. So still between the how to excellent, I can sleep well, etc. Well, it's kindly, it's a very good sense of humor. I like it. I like this the comment, not only for my technique, but she said it's a very good sense of humor. Yeah, that is my the feedback. This one was nightmare. This lady is a Chinese. She is a Chinese student. She struggled with the nightmare for nearly 10 years. I thought that would be the rest of my life. But after the first treatment with Dr. Wang, I would fall into sleep deeply. And after the second time, I could feel that my life come back to my childhood, which without any pain. And I guess I would never believe this miracle moment if I had never. Wow. And furthermore, he's a very nice and practical person. I like a patient that give me this comment. That's not for clinic everyone. So that is from a comment for a patient as well. Now, short summary. I think my time is just limited. Short summary. So the mental disorder are increasing, particularly after the pandemic, based on the data analysis from the UK government. Almost double of the mental disorders increased in the last 2-3 years after the pandemic. It's more. And acupuncture treatment, generally speaking, good for mental disorder and still under development. And acupuncture brain science guide us to use the brain acupuncture, including scalp acupuncture, to treat various different mental disorders. And 5 acupuncture points or leading areas are good at treating mental disorder, which I'd like to share with my colleagues in the future to help more mental patients in your clinic. Thank you very much. Thank you.
Next, there is who's the first? Questions. Oh, sorry.
Yes.
In my clinic, I take a lot of mental disorder. I use actually liver area more than the emotion area.
Okay.
But it wasn't that well. So
yes.
In the end, I kind of ignore that area.
Okay.
But my question is, in Dr. Wang's clinic, do you use emotion area a lot as it is?
Okay.
Or you plus some liver area
Okay.
for the
Thank you. Yeah, thank you for Yurong. Liver area is one of the scalp acupuncture as well, which is located in front of the hairline. We can use them as a similar of TCM theory, liver cheese stagnation, etc. It's good. It's good area. But from my opinion, I use more of emotion area than liver area. There are many reasons. One reason is, the liver area is underneath the hairline. It's the front hair, which is slightly out of the frontal lobe, and also which is slightly more sensitive than emotional area, which is only 2 centimeters. So as I said, sometimes I use liver area, but I majority use the emotional area. Is my opinion. Thank you. See some more. Oh, yes. From the west side. Yes, please. The bikes left. Yes, you.
I was listening to giving one space that's very fair. What is the paralysis? So what we
Okay.
And when I do the food model sensory area,
Yes.
okay, when you go squeegee, everything on my face.
Okay.
I just want to use. I just wanted to name that I was wanting to use it. See, I just need to go for the space below. Space below here. I think the full operating sensory area.
Yes.
It's for switching.
During the
Real stimulation that, when I get those, stuff is really useful to you, stay,
Oh,
just one word.
well, no, this is not exactly the question for today, but it's all. Each people, especially, we may have symptoms or some unexpected the reaction after you do the general on your own step. That is possible. I would say that indicates maybe this patient they have some of I would say the face contents possible some problem there. When the needle on the position area, this stimulate the brain very active. Then that area is even more active than others. So that's the possible related for this patient. Possible some anxiety, stress. That's your stimulation. The stimulate that's similar. So I would say that's possible will be disappear in for a couple of seconds in the from different sorry, yeah, go ahead.
you mentioned the balance area.
Yeah, balance area. That's balance area. Yeah. Okay. Balance area is on the back here. Or I use this model. Oh, this model very I call it life. Ask me where to find this model. Unfortunately, this is the handmade model by one of my students. After several times failed, she failed many models. Finally, she made two. One for herself, one for me. So with the name on the list. So I can't give you this. This is the only one. Okay, you can see balance area is just on the back of here, which is above the cerebellum. In the middle is a manual control. So these areas, they have the similar function for the manuals, particularly for anxiety, etc. So we may use
Okay, thanks. Next will be Dr. Yes.
Hi, yeah, it's very this see which I already have those yellow two with us, and the next section will be regenerating the as everybody knows the founder and the director it's very good for the genes of Meridian adaptation therapeutic. And today we really honor to have the Professor Yellow Jun with us to sharing about the application of the strength of Romanian application principle for reducing and toplify on the treatment of MS, FM, and S zone of scalp acupuncture. Okay, please.
Okay, thank you. Right. So my topic today, this afternoon, is not fully about mental illnesses, but because the photomotor sensory area is a very common area that you can use for mental illnesses, but it's also widely used for many other conditions. And so I am talking about something that it might not have encountered in your past experience. And it's only my own exploration or my kind of development of using these photomotor sensory areas. Um, I don't know how much you are able to use the photomotor sensory area in your practice to get the best or maximum effect of the treatment, scalp acupuncture. And as far as I know, Professor Zhao said he can use photomotor sensory area for almost everything in the body. It's like a tiger balm of scalp acupuncture. So you can use for almost everything. However, whether you can use it successfully, you can make the maximum effect depends on so many factors, right? So for example, Professor Wang says about, fast twisting of the needles is one of the key point and factor to use it. But if this is the principle apply for many of the points, why photomotor the photomotor sensory area can be used for so many different things, right? For me, I use photomotor sensory zone as a diagnostic method in my own practice of Xinzhen Meridian, which means I'm talking about something that you can use in yourself, your practice in the future for two purposes. One is to maximize the usage of photomotor sensory zones in treating any conditions, including mental illnesses. Second, it's to use for a TCN differentiation for cold and damp and deficiency and excess differentiations. So they might be interesting for people who's interested in herbal remedies. And this is as I said, this is my own development on that point. Before we talk about this topic, I would say some of the differential principle in Xinzhen meridian palpation therapeutics is we take the left and right, a very important part of the differentiation, right? Left side belongs to the cold, belongs to yin, basically. So that means in excess sides, it's related to the cold and damp or blood stasis and all that to do with the yin nature. On these deficiency aspect is related to the blood and yin deficiency. Vice versa, right side is to do with the yang nature. Access wise, it's related to the qi stagnation, fire. Deficiency wise, it's related to the qi and yang deficiency. Also, we use foot motor sensory area as a diagnostic method. Means we also apply the deficiency, like reducing the deficient tonic method or strengthening method, what you can say, or reducing method on the point on foot motor sensory areas. And the principle of using that is clockwise as a reducing method on a point and anti-clockwise as a strengthening method. So with this principle apply in using these points before we put needles in, we're using this diagnostic method to help to clarify the deficiency from the excess and the cold and damp from the qi and yang stagnations. So that's the basic ideas, and which in the end prove a very helpful method to help to differentiate the conditions, and then also help you to do the manipulation on the point on top of the fast, rapid twisting. We can also using pressing needles as tonic, lifting needles as reducing. So the reason for me to develop is because I found myself, all right, I might, if I want to use a foot motor sensory zones to use this point only by twisting, I can only get like 50% of a good result. So I started to explore what else we can do to make it happen, to make the people feel better. And that's how I developed into this direction. So the first thing is So for you, I think what you can get from lecture, so if you agree, is to know that is actually something more than just do fast twisting on the point. You can also do pressing or lifting on the needles on top of the fast needling. And if you are practicing herbal medicine, those tonifications or reducing methods will be able to enable you to develop more deeper understanding about the condition. Like, well, I'm going to show you a case later on with this, like herbal remedies. Right. So, the general routine of applying these method is basically meridian palpation, as I say, looking for the painful point, ratings, and get the most painful point, and then we also apply those test treatment based on those Boo and Share. Boo means tonic, and Share means reducing. Okay, so you do clockwise reducing, anti-clock tonifications. Then you are after this test treatment will be able to tell you, okay, left side help you the symptoms by reducing. That means a lot of cold and wind and cold, that kind of external invasions. Then you can also that can also guide you through to do those either lifting the needles or other points on the body to do the same job, right? And so with that, you are able to differentiate properly and do the treatment properly. Um, then then later on, we'll just do a demonstration of a case to tell you what exactly that the whole process should be. The just give you a bit more background. So you know this is the meridian testing, rating, and testing kind of treatment, and the 4 steps. And then it's involved 5 steps. First, the inquiry, palm reading, pulse reading to help you to select the meridians you're going to check. Then you do palpations and rating of the point. Then you do test treatment. Then you are able to get the precise differentiation, then which will lead you to the precise treatment. And you apply the anti-clockwise massage or pressing needles. Anti-clockwise massage is for test treatment, do massage on the point. And in the actual needles, you do pressing as the same purpose of tonification, right? So clockwise is by massage the point as a reducing method, and lifting the needles as a reducing method in needling. So, here we go. Just to give you the Chinese names, the Bu and Xie, anti-clockwise, and indicating. So basically, if the point benefit from Bu anti-clock massage, that means this point is indicating there is a deficiency condition, right? If this point benefit from clockwise massage, that means this implying that's a excess condition. And as I say, left and right, let's give you the ideas, right? Excess, so reducing effect. And then in the end, indicating that could be cold and damp and phlegm or blood stasis. If there is a anti-clock tonifying method on the point and make it better, it's indicating the deficiency, Xu, and then normally indicating yin deficiency or blood deficiency. Right. So for example, as I say, if you do like left side, this foot motor sensory area, if you do anti-clock, the people feel better, like for people coming in with sciatica. So you can use foot motor sensory, like back pain, leg pain. You do anti-clock, and immediately the pain was better. The other day, well, actually yesterday morning, before I came to London, I was seeing the last 6 patients. And then one of the young boy coming in, it just had this part. And then I was trying all this. In the end, he had on the right side foot motor sensory areas had the best effect. If you immediately he had a pain with the leg and tightness of the leg. He had difficulty bending down, and also he has a numbness on the lower tummy. Sometimes have like even bleeding in the urine. It's quite a severe condition. His father is a GP, and he brought him in, and I was testing all these points. In the end, 25 on the right side foot motor sensory area make him better. Is actually indicating he's got the qi deficiency. But however, his complaint was more about your left side. That's a very interesting case. But anyway, so this is what we in the end find out, and now that can guide us through to a proper differentiation. All right. So left side and right side all can be diagnosed and differentiated in this way and by this principle. And okay, so everyone knows about the photomotor sensory. So by the way, photomotor sensory area, the principle of reducing and strengthening method apply to this, and it applies to all points on the scale of acupuncture too. So you can use it for the emotional area or the balancing area, or even your liver and the stomach and lung. You can use it for all. Okay, so therefore, as I say, if that is a reducing on the left, then that means excess, and then indicating all these differentiate patterns, and that could give you much more precise information about what's going on in your body. Just show you a case study. So for people who doesn't really practice herbal medicine, it might be slightly difficult for you to understand. I will be a bit slower to explain this case, right? I think maybe we'll have difficulty. Oh, right. Sorry. I think that's issues of using. Okay, wait a minute. Okay, so let's go through this case, right? So this case is a most ulcer case, right? So this is actually a real case on my workshop in China. Last month, I went back to China to run my workshop, and one of the students attending the workshop had a case, right? He's been having this repetitively for many years, and it got worse when he was at the class, and the almost every 1 to 2 months, it's repeated happen on his mouth. And also he has issues of bowel movement. It's very hesitating kind of patterns to evacuate the stools. And it usually is not full. And sometimes he has those spicy food and drinking alcohol, which can cause very smelly small the stools as well as the ulcers. Okay, and and then usually after a big meal, or usually if you travels a long time, not having enough sleep, it get worse. Right. And this time it was on the right side. And it tend to be more on the right side. And but sometimes on his lips on the left side too. And today it was two happen at the same time. So as I say in Shenzhen meridian palpation diagnosis, left and right has very strong indications for yin and yang nature. For this, for the right side happening more, normally indicate the qi side, right, and yang side. And left side also means the cold side or yin side. That means either there is too much yang on the right side or too much fire, or not enough yang, means qi or yang deficiency. On the right side, on the left side, means or either it could be the cold or damp, or it could be a yin deficiency. So then we just need to see whether this is excess or deficiency, or whether it's cold associated or heat associated. So that's the differentiation to work out. So he's also in the past history, he also find out he doesn't like the cold and food and drink, and then usually he feels the cold more, had a cold hand. Looks like a yang deficiency kind of thing, right? But so he had 风水丹 and 甘露消毒, 甘露丹, and that helps to reduce those coldness and then discomfort in the stomach. However, it didn't help with the ulcers. If this coming from the same root, the ulcer should be helped by the medication. However, no. And also he finds warm water, warm food helps to comfort him. So therefore, it looks like it's more a cold type of ulcer. So you know the feng shui dan and ganlu dan, what they are for? Anybody knows? Right, feng shui dan and ganlu dan. These are the two herbs. The formula, the traditional formula. They usually for this is well known for reducing these Mingmen Xianghuo, the minister fire. Too much kidney yin deficiency with fire rising to the top. So that he think his ulcer is caused by the yin deficiency, which is not proving a good success. Okay, so but overall, when we analyze this case, we can see a clue line of there is some more tending to be the cold type, right, or spleen type and damp because that's a lot of like sticky, smelly stools. Yeah, but also there is some heat because he doesn't like also doesn't like the alcohol drinking and to big meals, right, and also late nights and travel long. So that quite often that could indicate some yin deficiency. That could also have some qi deficiency and the damp completion of the combinations. The tongue, as I said, tongue reading could be complicated for this case for today's event. So we'll just skip that. What we did is to go straight before we do also body test on the point meridian. We do the foot motor sensory zone test because that class I introduced this to give people a bit more quicker, like a shortcut for this diagnosis. So this is what we did. We found, okay. So we do minus means reduce on the left foot motor sensory zone, and we are testing on the pain in the lips and the tongue, and it didn't help. So that means 泻浊. So reduce damp or reduce insufficient heat doesn't make a difference. So it means it's not directly related to the ulcers, well, pathologically. Second, with 25, the left means 25 the blood yin, and that's slightly improved. That means the person has got some yin deficiency. And reduce on the right side means reduce the heat, fire, or qi stagnation, or insufficient heat. And actually the tone of the pain reduce more, and indicating the heat and insufficient heat could be a major factors. 25 right side and 25 qi didn't feel comfortable with. So from the foot motor sensory area, it's already indicating there's some yin deficiency. There is some heat accumulations for his case of ulcers. We then develop more into there to get more detailed reading because obviously we know that's yin deficiency. We know that it's the kind of thing, the heat, but we don't know where exactly it comes to because before he said he was using the feng shui dan, which is touching at the kidneys. It didn't work. So where can that be? So then we'll go to the meridians, to a 12th meridian to get more details. So this is what we did, okay? And in the end, we found out we do the tummy here. That's another method of the differentiation. In the end, we found out we reducing all kidneys 16, Huangshu next to the belly button, and it helps. That's indicating kidney yin deficient heat. And also we testing on the stomach meridian, so stomach 25. And in the end, reducing on the right stomach. Again, right means heat. So stomach fire and kidney fire. That's what we get from the tummy. And we found out reducing spleen 15. On the left side, that's dampness as well. But actually, this spleen has the best effect apart from these kidneys and stomach. And then stomach, and then also 25, we reducing on stomach, and it's better than 25 stomach, the run 12. So that again indicating stomach fire. So conclusion, we said this is yin deficiency and damp heat in spleen and stomach. Yeah, so that's what we did. We get the formula from. So we say spleen, stomach, damp heat plus yin deficient heat. We use 蟹黄散 is famous for reducing spleen fire, spleen heat, right? And 藿香正气 to reduce the damp in a herb. Then we add in something for the yin deficient heat. That will be a complete formula we use for him. So we can see here, like 藿香、石膏、栀子、防风. This is completely coming from 蟹黄散, okay? And then we have we're just adding the peilan because we believe that's the damp associated. And then we have 茯苓、苍竹、苏叶、厚朴. This is all coming from 藿香正气. Can you see that? Yeah. And then you also have 车前草、折蟹, and this from the 五苓散. Okay. And then 枳实 to reduce, to move it downward. And we also have this 生地、地骨皮、青蒿 from the yin deficient heat. And 黄芪、生麻和荷叶 to bring the spleen qi up, to help with the tongue. So as the general sort of adding together as a group. And then we also do the treatment with the point we chose on the tummy. And then immediately after the treatment, that the ulcers are much better, 80% are reduced with the pain. Okay, so that is the general ideas. And you can, I think from after today, you can actually start to practice, because that's easy for you to apply, even without needles. You can use in your own practice to test on the motor sensory area. Right, any questions? Welcome.
Your explanation about the differentiation between conditions in the skin probably I agree. Can I ask you, so what you mentioned giving the symptom of the pain, when it's either the right, left side, and push you. What symptom were you looking at? The pain reduce?
Yes, so the patient has got very painful mouth and tongue. When he chooses to move his tongue, he can feel the pain. So we can use the symptom that can be measurable on the site. Then anytime, anything. Sometimes if they have an ulcer on the mouth, they can use the tongue to push on. If that pain starts to get triggered more, that will be a tested or targeted symptom that we can work on. Motor sensory. Yeah, and
you were pressing or you were actually going left or right? What did you
okay, so I'm the temperature here. Right. So everyone knows there are key to use these properly. Okay. So first is to locate, and my way of locating is not only just by measuring, it's also by looking for the painful spot. Like say, for example, this is center point, right? So we say one cm next to the sensory or the tension. So that's 1 cm around here, roughly, right? And now I'll just press to look for the most painful around up and down. Anywhere around here. So that will be the starting point on this as the motor sensory area. Then I'll do very gentle anti-clock. So this is 45. Very gentle. I normally do 30 circles. Then ask the patient if they have symptoms get better. Like for example, yesterday we'll take a tight patient and we can ask them to bend his legs. We'll say, still tight, then we fight the other ones. Until we find the right answer. Okay.
Thank you. We have no questions. I also have the help.
Yeah.
Okay. This big formula is for weight dosage on.
This formula, in order to get because this is the case recorded on the class, and that's all written as a proper decoction composition. So this is the right dosage as a decoction. In like the dry herbs you have to boil out. Okay, and if you make my practice, I normally give people 10 days of extracted the concentrated powder. There will be we work out about altogether about 100 up to 115 grams of powder to patient. So all this will be like portion will be half 6 grams, 6 grams, 6 grams, 6 grams. Then adding together as a jar of powder.
people to take away.
This one different, the powder and the.
Well, obviously you can see the powder itself is half of the strength of the decoction. Half the strength. However, I think the effect is not half of this. It's actually almost similar. According to my own observation, right? So if people for general like chronic condition, right, it's not hugely different. So this usually takes, if people taking this, if this formula is the right formula, usually within 3 up to 5 days, they will notice the difference. 我在说中文，就是说这样的，就是草药和药粉的差别在哪？它虽然是剂量是草药的1半，但是它的那个在真正的临床的效用来讲，就是中的这种慢性病，3到5天内一定会见效。这样就是 if it's working, it's got to be just within 2 to 5 days. You will make difference, right? And then if the decoction, possibly around 3 days. Yeah. But it is the higher dose, right? So higher for like acute condition, you expect it to take effect within a day or 2 days.
Thank you very much. I think the diagnose is okay because your fellow students are very effective based on whether you had a very accurate diagnose. My question is, after 10 days or 2 weeks, you were simply getting better. Do you do the diagnose again?
Yes, but it depends, right? So according to my experience, for this type of condition, they usually, because you can see the patient shows different layers of different pathology. There is the individual, that is scan, that is the cheek and all that. So when you work on one major aspect, that pathology is dealt with and resolved, that will be second layer of therapy. Then the second time you will need to look at the second layer. Yeah. So the students in learn from me, they all find out not every time you're using the same point. Almost every time it's different point. Why? It's just because this is what we judge whether the treatment is effective or not. Because if the patient comes to your clinic for a treatment, every time you're using the same selection appointment, either it's true you're not making any difference to the patient, yeah, or it's you will done the wrong direction. Yes, for me, almost every time when they come, that will be different layer. Now, any chronic condition, they're always like this peeling onion. The first layer removed, then the second layer should be exposed. And if you're constantly working on the first layer, you're not coming to the core of it.
You do the diagnose repeater again when we.
Quite often, but we will focus on what they present there. Because quite often they will present with different symptoms. Yeah, and then also there are different symptoms, or if they repeat the same symptom, you will have to review on the meridian point. Yeah, you have to review them, see what else can be done. Yeah. Yeah.
Now next will be on group endings. Where you find the pressure and do come back and tell me that and do not want. 一个站桌，看他们谁愿意去，谁愿意跟我吃。
好的，好，继续。
哎，别说了。哎，这样好哎，咱们这个说话是。And 所以是完事。OK。先发现两个范例是这样。看到班长出现。
陈老师来赶紧手试下这个。
哦，你是这个呀？你的电脑没办
我的电脑其实跟它的页面是一样的，就是我电脑试的时候它也是这样。
这样吧，我给你告诉我怎么做，因为我们这个老师跟你们可能不一样，有时候就比较麻烦在这一点。
要不你登录我的？
这样吧，我先把那个关掉，
先关掉共享。
对，先把这个。